Welcome to the Energetic Psyche, a weekly podcast hosted by yours truly, Dr. Adrian Campbell, where we talk about real life, challenge assumptions, and explore different ways of being in the world. This week, I have Morgan Pemberton, a licensed professional counselor and EMDR practitioner, joining me once again to discuss the nuts and bolts of starting therapy, why we do it, how to find the right therapist, and so much more. Thank you so much for joining us, and I hope you enjoy. Okay, so welcome to the Energetic Psyche, a weekly podcast hosted by yours truly, Dr. Adrian Campbell, where we talk about real life, challenge assumptions, and explore different ways of being in the world. This week, I have Morgan Pemberton, a licensed professional counselor and EMDR practitioner. She's joining me once again, this time to discuss the nuts and bolts of starting therapy, why we do it, how to find the right therapist, and oh, so much more. So I just wanted to share a little bit about Morgan with you. If you tuned into our first episode, you know that Morgan is one of my very best friends in the whole wide world, but she's also a fabulous therapist and so knowledgeable, which is why I invited her back for this episode. So just a little bit of information about Morgan. Morgan is a private practice counselor in Columbia, Missouri. She received her bachelor's degree from Kansas State University and a master's of education in counseling from Stevens College. She's worked in many aspects of the mental health field since 2007, including case management, assessments, and outpatient therapy in community behavioral health settings. Additionally, she has been a member of the team that educates and trains the crisis intervention teams for both Columbia and Moberly police departments, and has donated her time to help educate various groups locally about self-care for people who are helpers. When not working or volunteering, she enjoys many craft projects, reading British murder mysteries, and loafing with her husband and two glorious dogs. I can attest, very glorious, Woody and Dottie. Awesome. Thank you so much, Morgan. I'm so happy to have you here.
I'm happy to be here.
It's just more time we get to spend together, which is always a plus in my life.
It seems so formal though, because I'm just like, oh, I need to be like professional, but it's okay. It'll loosen up. It'll be fine.
It's still us. It's still us. It's fine.
It's never going to be that professional.
Right? I mean, it's me. I say the F word. I mean, but yeah.
I literally have my little F-bomb sticker right here.
Nice. I'm pretty sure I have the sticker that I'm pretty sure you gave it to me. The one that says, "Don't be a dick."
Yes.
Yeah. It's on my laptop.
Yep.
I take it with me everywhere. Yeah, cool. So why don't we get started with just talking about like why people go to therapy? And, as a therapist, of course, I think your opinion kind of almost wins in this conversation, but I'm definitely going to give my 2 cents too, because I have a lot of clients that end up going from coaching into therapy or from therapy to coaching, or work with me and the therapist at the same time, which is a whole nother thing. But why don't we start with you? So why don't you tell us about why you've seen people go to therapy? Why it could be an option.
I think that also like one of the things I've noticed is, especially in the Midwest, there's been kind of a stigma about therapy for a long time. And I know that when I was growing up, I was told that it was for people with real problems. And for me, I like to tell people like I have yet to see a fake problem. So what I think people come to therapy for is like when what you're doing in your life isn't working for you for whatever reason, in whatever ways, and you just need to find more skills, or you need to try and like kind of unpack things, look at it from a different lens, because all the information that you have is no longer serving you in the way that you want it to. Now I see people that come through the door with like a lot of anxiety, depression. I treat a lot of people with obsessive compulsive disorder, trauma, stuff like that. But you don't have to have those things in order to have therapy be a right fit for you. It can be life transitions. It can be just kind of feeling stuck, or not necessarily always being able to find direction. Now, where you would go to a therapist as opposed to a coach, it might be like if something is deeper rooted, right?
Right.
And so like, yeah. And so you can kind of speak to that. Yeah.
Right. Yeah. Just to give an example is, I've had more than one client, probably just off the top of my head, I've had two in the last 3 years where we've worked through different types of habits that they're having trouble like changing or shifting. And as we've dug deeper through questioning and reflection and journaling and things like that, deeper rooted issues that stem from the family specifically. I mean, because I'm trained in Jungian psychology, right? So for me, it's very often bringing up stuff from the unconscious through dreams that they've had, or I pay a lot of attention to words. So using certain words in situations and exploring those. So just kind of pulling those strings from the unconscious mind to like reveal, right? Pull back the curtain. And then find these issues, like I had one client that realized that she was pretty sure she had been abused as a child. And as soon as that came out, it was like, whoa, okay, not coaching. Like,
Right.
let's get you someone good to work with. And the cool thing about, I think, me with my connections is I know a lot of therapists, right? I probably know more therapists than I know coaches, to be quite honest. So I have a lot of people to refer to. And then I had another client who, again, it was a deeper issue that we kept trying to work on a habit. I'm not going to share too much for confidentiality reasons,
Right.
but we were trying to work on a habit and just kept hitting a wall. So we'd try something else, hit a wall, try something else, hit a wall. And so I was like, so let's, work on this a little bit more and dig deeper. And what we found is deep, deep resentment in regards to familial relationships. And that's not coaching. That's right. Therapy, and we had worked together long enough that she was like, oh, I think I should probably do therapy for this. And I was like, beautiful. Like I was just about to say that. Yeah, perfect. And so like you said, those deeper rooted issues, I think, is where we would go to therapy.
Right. It's something to talk about, like the familial ties and family of origin stuff that comes up for a lot of people. A lot of therapists will really kind of look at those parts, but yet work in the present. Like, okay, but that was then, this is now. How do we heal you and get you going where you want to go? And it's not blaming the family. It's just saying like, hey, the tools that they had at the time were not necessarily the ones that are going to get you to where you wanted to go, or it like sort of laid the groundwork for some of these negative beliefs that you might have internalized because of lessons that you learned in childhood. I mean, there are also like, traumas from childhood that happen too, and stuff like that. But I think that's one of the misconceptions I see the most, is that somebody's gonna be like, you're gonna tell me that it's all about my mother. And it's like, no, I'm actually really not. But that's interesting.
Yeah.
Now I want to find out more about what you think therapy is.
Right. Yeah. Well, and I think what's important about what you're saying is that it's not just about the things that are like debilitating you to your life, but it could just be like I said, there's a habit that you can't change because it's connected to these old beliefs. And one of the big differences that I've seen in coaching and therapy. So for example, one of the reasons that I would refer out within that situation, could I talk about like those beliefs with them as a coach? Totally. Like we can talk about it. But they may need to sit in their feelings and process all of those emotions through multiple sessions. And that is not coaching. That is therapy. And like coaching should be a forward motion, action oriented thing every single session, in my opinion.
Whereas therapy can be very patient.
Exactly.
Therapy can be very patient. And it's like, I have had some clients in the past who have significant trauma histories. And I was like, we will touch that when you're ready to. And so like, if we need to baby step it along the way just to start getting some of that distress tolerance so that they can sit in some of those feelings, so we can actually process that. Like we can be very, very patient in therapy. And that's one of the things I love about therapy. But we also don't have to be patient. There's different types of therapies that are very solution focused and like, all right, if we want to hit the ground running and you want to get this sucker done, then let's do this. Like, here are the steps. Here's what we're going to do. But for a lot of things, like you can also slow down, and
Right. And
that
I
is
think
nice.
I think a lot of it does come down to like why you go.
Yeah,
Like I mean, I've been in and out of therapy for a lot of years of my life. And look at like I'm like, get rid of the stigma. And I'm still like feeling stigmatized right now. Right.
I
Just saying,
know.
like I've been in and out of therapy for a lot of years of my life. But it's also why my younger sister goes, how come you're the only one that's normal? And I'm like, oh, so much therapy. But anyways,
Well, yeah,
but
I mean, it's there, like, and you're right, but, like, there is still kind of a stigma, and we still kind of, like, hold
mhm,
back a little bit, but, I mean, like, when my clients have found out that, like, I also have been to therapy and, and I will talk about it very openly,
right.
and they're like, "Oh." I'm like, "Yeah,
Yeah.
ain't nobody got this all together," like, we all need a little bit of help, and we all have our own barriers that are hard for us to get around because we don't have all the skills to do that yet.
Well, not to mention you can't see yourself clearly. I mean, I don't know how many times I've called you and been like, Morgan, am I crazy right now for thinking this? Because I think I'm good, but I'm not sure. I think about most of the time, I'm pretty sure you go, yeah, no, you're good. And I'm like,
Well, I'll
okay,
be
cool.
like, "Well, not you're not crazy for that." No.
Right. Exactly. Exactly. Oh my
Which is
gosh.
just, like, because when I ask him, like, "Am I weird for this?" It's like, "Oh, you're definitely weird, but not for that." Like,
Right, right. That's a whole nother conversation. Yeah. But yeah, so like I think the different reasons you would go to therapy changes what your process is going to look like and the type of practitioner you're going to go after, right? I know we're going to talk about that more in just a second, but
sure.
like um so when I first started therapy as an adult, I I mean, I didn't have my PhD at that point. I didn't know shit about psychology, right? I just knew that I was depressed. Like I was depressed and I think I was 27, I think, when I started therapy as an adult. Like seriously, like I
Yeah.
want to fix some shit, right? I think I was like 27 and I went to a cognitive behavioral therapist and I was like, I'm tired of being depressed and I'm tired of having to consider medication because that's not what I want in my life. So I need to develop tools and I need to figure out where this is coming from. Because for me, and from like a Jungian perspective, depression is a symptom. Anxiety
Mhm.
is a symptom that all stems from something. So I was very much like, I want to figure out where this is coming from and be able to do something about it, be more empowered in my own care, right? Whereas the person that I work with nowadays is a Jungian analyst, which is totally different because I don't necessarily have any pressing issue,
Right.
but I'm still digging through. It's kind of like when I work with clients, I say, the first few months is going to be us pulling off that low hanging fruit. We're going to find all the things that are easy to change or shift or whatever. And then after that, it gets a little bit tricky. We got to go a little deeper. And for me, that's what being in analysis is looking at more minute details
Sure.
and where the little shifts are and the dreams and the words and pulling open the unconscious and, shadow work, stuff like that.
Yeah. Yeah.
So, and in between a plethora of different practitioners, right?
Oh, and there's so many different types of therapy, and there's a statistics, and I haven't looked it up recently, so keep in mind this is many, many years old, like at least 10 years old. But back when I was in my grad program, um, there was a study that was done was like looking at what makes therapy work,
Mm-hmm.
and the biggest factor in whether or not therapy is going to be successful is your relationship with the therapist. So, not the
Yeah.
type of therapy that they do, not their years of practice. It's whether or not you have a good connection with that person. So, that's also why trying to find a good therapist for you can take several tries because this person's personality may not work, or like this person's style may not work. I know that I'm not right for every person, and I'm very upfront about that when I'm doing consultation
Mhm.
work
Yeah.
with people before I take somebody on as a client, because I know how important that relationship is going to be. So I don't want to just willy-nilly take on a client just because I need another person on my roster. You know what I mean?
Right.
I want the right people. I want to know that, like, more than likely we're going to work well together. And sometimes I get it wrong. Um, Sometimes I have to then be really straightforward and honest and say, like, hey, is this working for you? Because I don't know if we're getting the traction that we could. And I think that I might just not be the right person for you,
Well,
which
and
is the
sometimes
typical
it takes
conversation.
yeah, sometimes it takes a little bit. I mean, even in the work that I do,
Yeah.
because they're not always as upfront with their with them, who they are and what they bring to the table. And it's not even no blame, not their
No.
fault, because especially when you're coming into a therapeutic relationship, you may not really know exactly what it is you want to explore or move into. Often, especially in therapy, people just show up with a symptom and they just want to get better. They just want their lives to be better, be easier. And so sometimes things evolve over time that I think creates clarity. And so yeah, that shift makes sense.
Yeah. I've had a lot of people who have, come in, and not like a huge proportion, but like just numbers over time, because I'm a prolific therapist. I've had quite a few people that have come in and said, like, "Yeah, I'm just here to, like, tackle my anxiety," and I'm just like, "Okay," and then we find out, like, "Oh, no, you have really, really deep-rooted trauma,"
Mhm.
and
Mhm.
that now we need to kind of shift our focus and approach things in a very different way. But if I'm not aware of that initially, then, like, we're trying to do anxiety work and stuff like that, when really we're not touching it. And I'm like, okay, what's really at play here?
Right. Yep. Absolutely. Um, so different types of therapy. Tell me what you practice, and I'll talk a little bit of like what I've personally well, how about this? What you've practiced and what you've experienced, and I'll talk about a little bit about the types that I've experienced, and then um, I mean, especially like SE, there's a few different types that I just want to make sure and put out there so people have options to consider.
Oh, absolutely, absolutely. So when I was going through my grad program, I was trained in a lot of different kinds of therapy. One of which, of course, is cognitive behavioral, because it's kind of the gold standard, is something that insurances will pay for because it has just been
In the
researched
US.
in the U.S.
In the
Yes,
US.
sorry, in the
Yeah.
U.S. In the U.S.
Okay.
It's something
I
that,
mean,
like,
that's where we are. I mean, there's
right,
not.
right. Yeah, I don't think of myself as going international, so but yeah, no, in the United States, for sure, it is something that, like, insurances will pay for, just because it's been more highly researched than a lot of other types,
Mhm.
and is considered like one of the more evidence-based practices. Now, what we're also finding, though, is that there are a lot of other evidence-based practices out there. There's dialectical behavior therapy, which is particularly used for people with personality disorders, but also for people who just kind of have a lot of emotional lability. So just like the highs and the lows and kind of emotions being all over the map, it really helps train um, your mind to be able to kind of deal with those in a different way. Um, Also, which I'm not trained in DBT. I went to a couple
Mhm.
of trainings and I was like, that's not for me. That is not for me. But I think the people that do it and do it well, it is amazing for their clients. But again, that's also why we want to look at, like, what kind of therapist do you want? What kind of therapy do you
Mhm.
need? What are the things that you're going to be seeking help with? I've done some, let's see here, it's uh, uh, acceptance and commitment therapy. I always just call
Okay.
it ACT.
Yeah.
So I'm used to, like, all the acronyms. There's so many acronyms, but acceptance and commitment therapy, that's one that I feel very connected to and comes very naturally to me because it blends so many different kind of approaches into one really big concept to actually give you more psychological flexibility than just, like, cognitive behavioral CBT. Um, Narrative therapy is something that I find very fascinating and
Mm,
I'm really close with, because I think how we tell the story of our life is how we do our life.
yes, yeah.
And so, like,
Narrative is
what
the thing I connect with a lot, even in my own work. Yeah,
I love it so much, and it's,
yeah.
and it was so funny when I was going through my grad program, I was one of the only people that was just like, this is amazing. How do I learn more about this?" And everybody was like, "Nobody connects with that one." I'm like, "They're not reading it right." Like, I was like, "No,
Right.
I think everybody could connect with this." And of course, it's just because I get excited about telling stories and I like hearing people's stories, but I also, like you said about word choice.
Yeah.
Like, if I use certain words, I'm going to think of myself in certain ways.
Well, and
Yeah,
so, I mean, that's a very Jungian thing, right? So in Jungian psychology, it's all about image.
yeah,
And the image that we create is created through our stories. And
mhm,
so I mean, my doctorate dissertation was partial narrative form because
mhm,
I think listening to somebody tell their story and really paying attention to the way that they tell it, not just um, the overall story, but the words that they use, their voice, the way their voice changes, the way that their body shifts, the way their breathing moves. I mean, all of those things can tell you so much about what that person is going through. And again, it's that like we can't see ourselves, right? So when you're telling someone a story, they're able to view you as a witness and reflect back the things that you maybe can't see. Yeah, I think narrative is so powerful.
right, which is also why I think, therapy is so different to, like, talking to your friends or talking to,
Yeah.
family members or a clergyman or something. It's like, this is a person sitting across from me that is trained to look for the pieces that you're either glossing over or trying to see, like, what's not there, like, what are we omitting from the story?
Mhm.
What are the pieces that we're not connecting with, or it's just it's a very, very different relationship. um and not that I think that friends and family and clergy are not, like, absolutely wonderful. You want to connect with these people in your
Right.
lives, but also, like, therapy is going to be so different from that, just because it's a person who's trained in these different techniques that can help you kind of push past things that your family and friends may not be able to.
Well, and also, I mean, I know the big one, even as a coach, is like, I don't have any like personal buy-in in your
Right,
story, right?
right,
So, like, when you're sharing with me, there is so much more freedom in that because you don't have to shift or adjust whatever you're telling me based on what
right.
you think my reaction might be or how this story might be impacting me. Like, I'm impartial. Same with a therapist, is that I think there's such a beautiful freedom in that you get to just share exactly from your experience
Mhm.
without having to worry about how the other person's going to react, how it's going to affect them, if it burdens them. Because how often do we not share the whole story to people we care about because we don't want to burden them? I mean,
Right.
all the time. I do it. I'm not going to lie. I think we all do,
I think
you know?
everybody does to a
Yeah,
degree, right?
right. So I think, to have a therapist that's also very important too, to be able to bring that.
Yeah.
So different types of therapy that I've experienced. So I mentioned the cognitive behavioral therapy was
Mhm.
my first go. And though for me personally, not a fan any longer. And for a lot of the veteran work that I've done, I feel like it's overused
Mhm.
personally.
Yeah.
Personally, Adrianism, throw it out if you don't want it. I feel like
Right, right. It's
CBT
like
is
these are not like my opinions here are not the opinions of every therapist
right.
or of the APA or anything. Like, this is just me talking. You know?
This is just us. This is us. Yeah.
Yeah,
And
like,
so like
good to notice that.
yeah. So I feel like CBT is really overused in the United States, overly relied upon because it is evidence based and it's like this tried and true method or whatever.
Right.
But in a lot of the research that I've done with the work that's been done with veterans in VA hospitals, it's not that effective and they just keep using it. So I will not jump completely on that soapbox, but there's that. So
Well, no,
anyway,
and that's what I found with, like, acceptance and commitment therapy is, it gives you more psychological flexibility in the long run. CBT is good for, like, short and very specific kinds of things, but then you have
mhm.
to keep learning new things every time something pops up, as opposed to stepping back and going like, wait, my approach here, like this is what's happening. Like I'm letting my emotions drive the bus,
Mhm.
and so if you can gain more of that psychological flexibility, which different types of therapy can do, yeah, it's like I like CBT for what it does.
Yeah.
I just don't think it's like the catch-all for everything. Oh, and just real quick, one that I did
Sure.
not mention was EMDR, which is a very, very different kind of therapy, and one of my very favorites, and I do it a lot. So,
I know, I'm hoping to, like, pull you back on here at a later date to talk all about the EMDR.
oh yeah, because I have talked ad nauseum about it, and not only to you, but also like to different groups, like the psychiatry residents at MU and stuff like that. I've done like
Well,
multiple
because when you find
presentations.
something exciting, you gotta share with other people.
Yeah,
Yeah.
yeah.
So, and just so everyone knows, EMDR stands for eye
Eye
move.
movement, desensitization, and reprocessing.
Thing.
And it used to just be eye movements. Now it's a lot of like bilateral stimulation, which just means opposite sides of the body.
Mhm. And so and that, directly impacts the way your brain processes information, right?
Yep,
Cool.
yep.
Yeah.
I will
Awesome.
not go into it because I could go like if I get on that road, I am not getting off
Not
that
on
road.
this
I love it.
episode.
Yeah,
Next
yeah. No,
episode.
that's for another
Next
one. That's for
episode.
another one. We'll stick a
Yeah.
pin in that. Stick a pin in that.
Exactly. Yeah, so but cognitive behavioral did work really well for me, like, when I first got into it, and I think
Sure.
from what I've seen and the people I've talked to, it is a really nice way to step into doing therapeutic work because it's very simple, it's very cut and dry. There's a problem, do this, solution. It's very solution focused.
Yeah.
And to be honest, a lot of coach training is CBT.
Yep.
Like when I went through like my course, my certification course was like a year long. And
Mhm.
I was working on my undergrad in psych at the same time. And I was like,
Like,
this
wait
is
a
a lot
second.
like, okay, yeah, it's CBT. Cool. So anyway, so I've done CBT. I've also done some art therapy, not a lot, not as much as I'd like, but really enjoyed it. I can't move into it as fully as I think some people. Like it could never be my main process because I'm a very wordy person. So I like to talk. I like to
Mhm.
talk therapy.
Yeah.
But I also have done some somatic therapy and somatic practicing, um, which I never knew how much I loved until I started doing it. And as somebody that grew up an athlete, served in the military, I love being in my body, love it. And I had no idea that you could process trauma, like full trauma, without talking, like
Mhm.
just through your body. And so that has really blown my mind. And I would even say, like, I haven't done yoga therapy, official yoga therapy, but I've done therapeutic yoga, and that has also completely changed my life.
Mhm.
Therapeutic breath work, all the body stuff that I've done has been absolutely amazing. And then now, like I mentioned, I've been working with a Jungian analyst for quite some time and absolutely love doing that work. Um, there, it's very different than I'd say standard American therapy because it's
Mhm.
not solution focused. And I often will explain the difference between like CBT therapy and Jungian psychotherapy as like often CBT therapy is here's the box. This is what a normal American person should be.
Mm.
These are where your behaviors should lie. Anything that's outside of that box, we're going to fix because it's
Right.
not supposed to be there, right? It's a disorder, if you will, ordered disorder. Whereas in Jungian work, it's much more like, okay, who are you as a person? And what's working in your life? What's not working in your life? And then we work on those things that are not working instead of trying to fit into the box. And I know that in conversations you and I have had, even though you're not Jungian, that's very much how you practice. And I've talked to a lot of therapists that are friends of mine, and they say the same thing.
Yeah.
Um, it's
If
it's
it's not
about
if it's
person.
not disordering if it's not disordering in your life, I'm not going to pathologize it. Or like if something is working for you that maybe other people would be like, oh, you really should work on that. Like, I don't know. I'm not the one living your life. It's about the person. And
Hmm.
so some things you want to keep a hold of, some things you want to let go of. And who am I to tell you which ones those should be?
Well, I mean, I'll be honest. I remember at a certain point in my analysis, like I realized so many parts of my personality are like trauma responses.
Oh, oh, right.
Like, I
You're like,
mean,
oh,
just things that I've learned to do to survive and like be healthy and have friends and whatever, right? Because I had a pretty traumatic upbringing. I'm not going to try and downplay it, especially not here. Um, so at a certain point, I was like, I remember asking my therapist, so I'm having a hard time figuring out like what's left. Like after we work through all these trauma responses, like who am I? Like who is my personality? You know? And I remember her saying, kind of like you just mentioned, is like, what do you want to keep? Because it's all you. Like however it's born, however it's crafted, wherever it comes from, it's still you. It's just, is this working for you? Is it not? Do you want to keep this moving on in your life or not? You know? And I was just
yeah.
like, oh, okay. Because I mean, to be quite honest, as weird as it might sound, like there's some trauma responses that like I'm cool with. They've like served me really well, and like I don't
100%.
want to get rid of them.
No, I think like there are certain things that I know that I have experienced in my life and that have changed the way that my brain functions because I had to
Mhm.
adapt to situations.
Right.
And so I don't know. I think that there's a part of me that I'm just kind of like, I like the fact that I am detail oriented. I
Right.
like the fact that I don't like to make mistakes. I mean, granted, I'm much better at it and it's no longer like killing me. Like I can't,
Yeah.
it's not like I
Yeah.
have to be perfect all the time, but I like being precise. That is
Right.
something that
Right.
matters to me. I like being reliable,
Mm-hmm. Well,
like
like for
there,
me, one of
yeah,
my trauma responses helps me be a good teacher
yeah,
because I grew up in a chaotic environment where I had to pay attention to and tend to the emotions of the people around me
mhm,
to make sure that like as a child that I felt safe, right? And so as I got older, what that gave me is the ability to manage a room very well. And I can have a room with 20, 30 people and I can pick up on somebody like 3 rows back on the back right that isn't enjoying themselves or isn't engaged or whatever it might be, you know, because of those the heightened sense of awareness in my environment. And so, yeah, for that, it makes me a better teacher. So I'm,
yeah,
you know, I mean, I'm not grateful to my trauma, but that I am cool with the
no,
skill.
yeah.
Yeah.
It's like, and that's one of the things. Is like I'm not trying to be like Susie Sunshine over here and say like there's a silver lining to every dark cloud, but I'm just saying like you can't
Yeah.
go through certain things in your life and not gain skills from it,
Right.
you know? So while I don't want the stuff that I had to deal with, like like my own traumas and stuff, but at the same time, like I learned some stuff that's pretty darn helpful.
Well, and let me also put out there too that like, so my, let's say hyper awareness, I'll call it,
Mhm,
right? Hyper awareness of my environment. Now, at this point in my life, at 44 years old, with the amount of therapy that I've been through, I can look at that and go, wow, I'm glad I have that. That makes me like a better teacher. Now, 10 years ago, that was not the case. 10 years ago, I didn't like having my back open in a restaurant. I like to be able to see the entire room. 10 years ago, if somebody got upset in a meeting or whatever, and I couldn't make them feel better, I might get upset about that. Right.
mhm.
But it's through the therapy and the work I've done that I've become aware that it's a trauma response
Yeah.
and that I've been able to make that choice. So I just want to be clear about that too. Like, I'm not sitting here, and I'm pretty sure we're aligned in this. I don't think either of us is sitting here going, it's cool to have trauma responses and like hyperactivity. Like, that's cool. It's not that. It's that once you do the work,
Yeah.
you are in an empowered position where you get to make the choice. Is this something I want to keep or not? And if not, you can work through it. Like, that's something you can work through with your therapist.
Right. Well, and on the heels of that, something that I heard the other day, and I'm paraphrasing, but somebody was saying like a lot of people think of like post traumatic stress disorder as like my brain is broken because of this trauma that I suffered. And
Mhm.
it's actually
Mhm.
your brain being adaptive. That
Right.
it's your brain actually adapting to something that was so adverse that now you have these trauma responses, which if you think about it, it's like your brain just trying to keep you alive.
In
Um,
veteran circles, we often say it is a normal reaction to an abnormal experience. Like the
100%.
way that you reacted is normal in an
Mhm.
abnormal experience. And I think
Right.
that is exactly it, is people end up feeling broken
Mhm.
or wrong or like they need to be fixed, but it's
Right.
more of like an adjustment, right? It's like
Yeah.
it's a
It's
recalibration of the nervous system in the brain. We're
yeah.
just gonna tweak, recalibrate.
Right, and that's where, like, kind of like, again, therapy can help sort of break down the it's not your panic is not keeping you safe. It's the things that you've learned that are keeping you safe, and finding ways to then let some of those adaptations go,
Mhm.
and being able to, like, yeah, just recalibrate to a little bit lower level so that it's not quite so acute.
Yeah, and because as you change different situations, these symptoms,
Mhm.
right? They're gonna start showing up as symptoms because they no longer make sense in this environment.
Right,
But, like, if
right.
you're in a chaotic environment as a child or you're in a war zone, then your hyper awareness totally fucking makes sense. And, like,
Yeah,
yeah, you should have that. It's going to help you stay alive. And so
yeah,
it's okay. Like, not only is it normal, but, like, good job. Like,
yeah.
good job, body, like, making that happen. But then once you come home, it's a symptom, right? It's no
Right. Well, because 'cause
longer
you're no longer in that heightened situation. Yeah.
exactly. Yep. And so I think too, just talking about different types of therapy is that like as you move through different stages of healing, trying different types of therapy can be really beneficial. So, like with me, maybe starting with the CBT is the way to go. Even if you have heavy trauma, maybe that's like your foot in the door, right? Like let's sit down, let's start having a conversation. Let's see if this can be verbalized. For some people, that works a little bit, doesn't work at all. Maybe you have to start with the body, and just being open to trying different types of therapy depending on where you're at in your healing journey, realizing that it's not like, oh, I'm a CBT type of person. Oh, yeah, well, I'm a this type of person. But at different points in our life, depending on different situations, you're going to flex and flow, And I mean, I've gone through some pretty rough stuff in the past few years. And I'll tell you, I called and reached out to friends that work in areas that I never thought I would because I was experiencing symptoms in ways that I had never seen before. And I was like, I don't know what to do with this. Like, can somebody help me? So it's okay, I think, to shift around a little bit.
Absolutely, and, to also kinda go back to one of the earlier questions that you asked is, like, kinda like how do I do therapy?
Mhm.
Like, what are things that I gravitate towards? I have a very eclectic approach because I'm trained in so many things
Yeah.
that to not use that whole toolbox seems just silly. So I don't wanna do, like, cookie cutter therapy for all of my clients and just do, like, CBT, 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 CBT. It's like, I'm gonna have, like, a conversation, we're gonna pull in different things from different
Yeah.
modalities because that's and then I learn it's kinda like AI, it's like I'm learning how to adapt to, like, what this person needs in session.
No,
Um,
AI is like you.
right, I know AI is like me, not me like AI, but, like, I just watched The Matrix again, so it's a
Oh
whole thing.
gosh. Oh gosh. Okay. Okay.
But yeah, so it's just one of those things where like you can find therapists who do just one type of therapy.
Uh-huh.
But I think most of the people that I have a strong appreciation for in my field are the ones who adapt to their clients as opposed to trying to make different therapies work on every person.
Yeah. I mean, I think the longer you're in practice and the more you learn, honestly, in any profession, you're going to synergize this stuff, right? I mean, it's like at this point, I'm I mean, so I'm a certified coach. I have a PhD in Jungian psychology, depth psychology with a somatic emphasis. I've got undergraduate degrees in electronics and psychology and like all kinds of weird stuff. We don't need to go there. But I'm a Reiki master. I'm a crystal healer. I'm certified EO essential oils practitioner. the heck else do I do? Chakra dance facilitation, like somatic mindfulness, meditation. But so when somebody's like, oh, what do you do? And I'm like, hello, I am Dr. Adrian Campbell, and you'll just work with me. Like, come with me and let's see if we can make life easier. Is kind of where it's gotten it. And I think that the longer you're in practice, it's just how it happens. You go to somebody for who they are, not just the certifications that they have, right?
100%. 100. And like,
Kind of like you said, the relationship is the most important.
yes. And I also like to remind people that not every therapist graduated at the top of their class. So there are some people that may not be that great out there too. And I just
talk about that.
It's like some people do the work. Some people put in a lot of that effort and energy, and they really want to do things at a really high level. And other people are just, I don't know. I saw some people in some of my classes that were just like, they didn't read, they didn't, and I'm like, why? You're paying a lot of money for this. Why wouldn't you want to learn it all? But that's coming from my own perspective, right? But there are some therapists that aren't great.
People who've been in practice for 30 years and like the only CEU courses they go to are the bare minimum to check the box, and they actually haven't learned anything new in 30 years. So they're practicing like they were when they first got trained. That like obviously makes me a little pretty like because I feel like you need to like your clients deserve, your patients deserve for you to stay well educated in your field, because it's relevant. It's psychology. It's literally less than 150 years old, the whole field. So like it has changed so fucking much in that amount of time that it's incredible that we would think in 10 years there wouldn't be giant advances. And as someone, I'm not a therapist, but I do academic research, like PhD level research in psychology. I'm telling you, it changes like that. So you have to stay up in it to stay up in your field,
100%. 100%. And I also think that there are some folks who have not, like a lot of people who go into therapy or like as a profession, they got their stuff that they're trying to figure out. They're trying to figure themselves out. And if they haven't done the work, then that will be dangerous for their clients.
I was just having this conversation yesterday with somebody about a different field, different profession, but like,
you gotta
do your own work.
You have to do your own work. Which that in my program here in Columbia, when I went to Stevens, it was so emphasized where it's just like, therapist, heal thyself, like get your shit together. So that
I started with my analyst because of grad school. They forced us to have a therapist. Like it was a requirement of us getting a master's and PhD. You had to have a therapist the entire program. Which made sense because when you learn about some of that stuff, you're like, oh my God, is that me? And then you go sit with your therapist and you're like, okay, so in school today, they said blah, blah, blah. Is that me? Because it feels like it's me. And then they're like, okay, maybe like this part, but not the whole thing. And you're like, oh, okay.
Right?
Okay.
There was a really great episode of Frasier, which is an old comedy TV show, and Frasier Crane is like the psychiatrist on the radio or whatever. And I'm listening. And this person's calling in. They're just like, okay, so I'm pretty sure that I have this disorder, this disorder, this disorder, this disorder, this disorder, and keeps going on. And he goes, so you are either not going to be the right client for this kind of conversation, or you are a first-year psychology student. And I was like, no, seriously, because like when I went through like my abnormal psych course, I was like, I have all of these, and it's like, well, because we do
that way
aspects of them, and like, and it's just looking at like how disordering is it,
right? Well, and it can be really easy when you start paying attention. And I'm just going to throw out there too, TikTok, Instagram, like how many freaking reels do you see that it's like, if you have this, this, and this, then you have ADHD, or if you have this, this, and this, then you blah, blah, blah. And like, I'm not going to lie, I've been a little sucked in to like one of them. I think it was ADHD. And I went to my analyst and I was like, so I feel called out in a lot of these Instagram reels. I'm like, you've known me a long time. Do you think I have ADHD? And she was like, Adrian, let's just even talk about that term. And I'm like, okay. But I mean, I think about like the younger generation and all of this stuff they see. And I've actually had people tell me like they've self-diagnosed, like this
Oh
is what
yeah.
I have, blah, blah, blah. And I'm like, what really? Like, did you get diagnosed? Or like, well, I mean, I've watched enough Instagram reels or TikTok videos that I know that that's what I have. And I'm like, okay, let's just take a deep breath, like back away from the rando people on the internets.
Well, and I have so many clients who, yeah, again, like and there are even like therapists on there that are saying like, hey, these are signs or symptoms or blah, blah, blah. And people are really connecting with it. I also go like, okay, then get an evaluation,
Plus, like,
right? Like
who's that therapist?
if you really want to like have that label, if you really think that this label fits you, you got to
Mhm.
get evaluated. Like I have so many
Right.
clients that have said like, oh yeah, I'm autistic, and I'm like, oh, where'd you get your evaluation done? They're like, no, it's just like I see all these things on TikTok and I just really connect with it. And then I've gone on all these blogs and I've done all this stuff and I'm like, oh, like and maybe, but we're not gonna know unless you get an evaluation.
Well, and then it's like also, I think we're totally digressing, but anyway,
I know.
just for one more second, I think too is that sometimes people just really want to label. Like I've encountered that a lot with like when I do the Myers-Briggs personality indexes,
Mhm.
right? Is people are like, oh, this is who I am now. And it feels very disempowering. Whereas I would, if there is a label of any kind that enters your life, I would hope that it's empowering. Like this is information I know about myself now, which I can use to like empower my life, to change my
Yeah,
life, to shift this, blah, 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 blah. And so I think when you don't get any kind of formal evaluation, you're just allowing it to stay in that disempowering state. And it's just this label versus
right.
information that you can use.
Right, or like tools that can help you
Right.
feel more empowered in your life or feel more efficacy
Yeah.
despite whatever disorder or diagnosis you may have. That's where I think that's we're not seeing those follow-ups on TikTok. So I mean, like, and we'll
Yeah.
stop talking about that now. But no, I do think that that is very dangerous. Is like the self-diagnosis.
Right. Okay. All right. So I'm going to shift us just how to pick a therapist, right? Because I think this is really important. It's one of the questions I get all the time. And I often will help people. Like, I give a free 30 minutes call to like anybody. And in a lot of those calls, I refer out. Like, I don't keep them. A lot of the conversations where I refer out pretty heavily is military and law
Mhm.
enforcement, just
Sure.
so I can see kind of like where they're at, what they're dealing with, and who might be a good fit. And I'll go to Psychology Today and I'll click through and I'll read resumes and I'll help them find, who they want to go to. So we talked about different types of therapy, background and experience. We touched on that. Just because they have a degree doesn't mean they're any good at what they do. Even if they got 10 degrees, that just means they're really good at spending money on school. So I'm gonna put that out there too. so
They're
so
really good at reading.
so for me, like the best indicator for me has always been like I'll ask if I can have a free like 20-minute phone call with them and just have a conversation. The one time I didn't do that because the VA, anyway, they
Yeah,
hooked
because
me up
of the
with
VA. Yeah.
somebody. And I know that we've had this conversation, but it was the one that said she had experience in Jungian psychology. And then she called it Hungarian. And I said, no, it's Jungian. And she went, Jungian, Hungarian, same difference.
Whatever. Yeah.
Worst first therapy session of my life. And I never went back. But, anyways, so the free phone call for me to touch
Yeah.
base has always been really helpful. But what would you say is most helpful in like checking out someone's background and experience?
So I think that like I look at sort of there are a few things that stick out to me when I'm looking at Psychology Today profiles. Because I think that's it. I mean, like I'm on Psychology Today. Like I think it's a very helpful thing. One, I would check to see if they take your insurance. That's a
Oh, gosh.
big
Yeah.
piece of the puzzle. You know what? And I don't know how it is in Europe or whatever, but I would hope that it's better than here. But that can
Yeah,
be a factor,
like
just
months.
can I afford this? Um, Two, I would look at what are their specialties? Because you get to like pick like three things that you want to say that your
Mhm.
are like your main focus that you deal with, like the most that walks through the door, and how many other uh, struggles or concerns do they also claim to be proficient in? Because there are some people that will just like click on every single
I
one.
was just gonna ask what your thoughts are on that because, like, if I go to a therapist profile and they're like, "Yeah, I specialize in these three things," especially if they're all wildly different, but like that's a whole nother thing. So they specialize, but then they have like 40 other modalities and specialties selected.
Yeah.
That really turns me off because I'm like, there's no way you can specialize in all that stuff.
Well, and it's like you may have been trained in that. But like I don't have DBT on mine, even though I have been trained a little bit in it. Like I don't have it on because I don't like it and I'm not
But
gonna
were
do
they
it.
trained during their undergrad? Or were they,
Right.
like, actually trained? That's what I
Right.
also,
Well, and
like,
you can get
question.
some of the training during your undergrad, depending on what your practicum is and stuff like that.
True, true, yeah.
So I don't want to diss anything that was like pre like your actual degree, but yeah, I think it's just because you have an affinity for something doesn't mean that you're really trained in it.
Right.
It's like I would just be cautious on like if there's like 40 things that are clicked, because that's probably a therapist who doesn't know themselves that well, because they
Mhm,
don't. Because like I know I am going to be like largely acceptance and commitment therapy, largely EMDR, largely narrative. There are
mhm,
certain things that there are certain problems that are going to walk in the door that I'm going to be more comfortable with, anxiety, depression, PTSD, bipolar disorder, OCD, stuff like that, or that's my wheelhouse, that's my jam.
mhm.
But I
So,
know that
also, populations.
yeah, yeah,
That's, I think, a big if they mark that they work with all populations regularly, that's another one that I'm like especially if you're in a marginalized or a sensitive population,
yeah.
um, again, I have a lot of experience with veterans and law enforcement, and
I have a
who
lot
they go
of
see is so important.
yes, and I have a lot of training with the LGBTQ plus community, and in particular transgender issues.
Mhm,
And so, like for me, there's a lot there. And so, like I just was talking to one of my friends who had some opinions about surgery and stuff like that, and surgery letters. And we were in. I was able to kind of talk through like my process and why I believe the way that I believe,
mhm.
and they were like, oh, that's true. I'm like, because I could get a nose job tomorrow and I don't need to have a letter from a doctor saying that it's okay for me to do that and permanently alter my body.
Right.
So to me, I'm just like, I think it's interesting that we are going in that direction with like a particular group of people because that feels very, I don't know,
Yep,
yucky to me.
yep.
So
So but yeah, so the populations they work with on
yeah,
top of the different modalities they have, and before you choose a therapist, like, I would really take a few moments with yourself to think about, like, what are the types of things you want to talk about or want to address? If you are consider yourself to be in one of those communities or that something's important to you, like, even, like, something as simple as feminism, feminist rights. Like for me, that's a big deal. I don't want to sit with a therapist that's going to judge me when I'm talking about like being held down by the man. Not that that comes up like all the time or anything. But as a female in a male dominated workforce and industry
right.
for a long time, there's trauma there and I have some issues
Mhm.
around that. So for me, being with someone
Yeah.
open in that way is important.
Right,
Um,
and I think, like, looking at, like, if they identify as, like, a Christian counselor or if they deal
yes.
with, like, religious trauma, then that tells you about the provider. I think also,
Mhm.
like, when we're looking at yeah, the consultation is the biggest piece. I think you really having a consultation with a therapist is, gonna get you the most information about, like, whether or not you like this person or whether or not you want to, continue on with that person. But, yeah, I think knowing, if your therapist is, I don't know, particularly, like, politically active or something, like, that might make a difference to you. Or if
And
they're
then that's the thing
doing
is
it
it
really
might
right.
yeah. So I think like the big thing, get clear about what might matter to you. Like, it doesn't mean you want to like make sure that you're going to pick out a therapist that's going to be on your side. But it's not about that, but it's just making sure that you're going to have the best opportunity to create a relationship that will result in healing, I think. And so don't be afraid.
You want it to be a safe space.
Exactly. Don't be afraid to shop around. Like you can put together like an email that says like, hey, this is me. These are some of the issues I'm dealing with. You can be as specific or vague as you want, whatever. And then, ask very clear questions. And you can even say, have you worked with members of like the LGBTQ community? Right. And is this a common thing for you? Yes or no, and you can just ask straight up. Yeah. And then based on the responses you get from them, from the emails, maybe then you say, respond to the ones you like the most. Would it be possible to have a short, like 10, 20-minute phone call so we can just chat before I decide and see what they say? And then
most people will give that. Also, Psychology Today has like little videos. I haven't done one just because I'm lazy and I have a lot of business right now anyway. So
you're full. You're like waitlisted.
I'm so full, like all the time. Anyway, but so I've gotten lazy and I haven't done it yet. But there are videos that you could click on too, and you can kind of see what the person's like.
And go to their website.
Go to their website. I also recommend if you need to be told what to do, then you need a directive therapist. You need somebody who's going to say, this is what we're going to do. This is what you're going to try. Come back in the next couple of weeks or whatever, and we'll talk about like what you learned from that process. I am not the most directive therapist because I'm kind of like, man, we're going to figure it all out together. Like I'm very kind of like laid back and like, I'm not going to tell you what to do. We're going to discover what to do with like along the way. Like I'm more of like a guide or, somebody who like, I have a lantern and you just didn't have the light. Like there's a path there that you know how to take. We just need to show you where it is.
And some people in that type of therapy can feel lost.
Yeah. And that's why
they need a stronger hand. Yeah.
And I'm very open about that with like my potential clients. I just really think that, again, the consultation is the biggest piece. I think you hit the nail right on the head on that one. But then, also just look at their websites. Look at if you get a good feel for somebody.
So we had a couple more things I wanted to make sure we bring up. We're running short on time. So you mentioned briefly insurance versus no insurance. Make sure you can afford it. Big deal. Because some therapists are like $300-$400 an hour. Some are $75 an hour. And it doesn't mean that the one that's less expensive is crappy. So just heads up on that. And it doesn't mean that someone's expensive is good. So heads up on that. Right. A lot of therapists also have sliding scales. So those are things. And some of them, because I know insurance, it often only covers like 6 to 12 sessions, which like blows my mind and breaks my heart. In Europe, you get months and months paid for, which is incredible. But sometimes they will work with you to like use insurance for one and then pay a reduced fee out of pocket and then insurance. Have you heard of something like that?
Yeah, I think that there are a lot of changes that happen. And it also depends on the laws in your state, whether or not people can do that.
Oh, true.
Yeah. There's like, it's like a whole darn thing. So you have to be really cautious and careful. But yeah, just looking and seeing, how much does your insurance cover? I will be honest, I don't get a lot of pushback from insurance companies about like they've had their 6 sessions and now they're done. It's like what you do need to know about insurance is insurances need a diagnosis at the first session. So have that conversation with your potential therapist and say like, okay, I want to go through my insurance. What are we putting down there? Because just because that's what you put down there isn't necessarily always what you're working on. Right. Or you're like, this fits mostly.
When do we ever have like one issue? I mean, we're complicated beings. So
right.
Yeah.
So we all got like subscriptions. We don't have just one issue.
And if you don't have insurance and you can't afford a lot, don't immediately dismiss therapy. Because
Right.
like I said, a lot of places have sliding scales. Like I even have a sliding scale spot as a coach, believe it or
Mhm.
not. And you can always like write a therapist that you're interested in and say if they you can't afford them, ask them to refer you. Say like, look, I don't have insurance. I can't afford your fee. Is there some way that you can help me find a way to get helped? And
Yes.
I can almost guarantee you they're going
Yeah.
to help you find something.
Almost everyone knows, like, the free or reduced rate
Right.
places. You might have a little bit longer wait time. That,
Mhm.
unfortunately, is just the case because there's such a high demand for therapists right now, but also, yeah, it's absolute and they're not bad therapists. They're
Yeah.
good therapists. A lot of times you can find really great therapists at places that are, like, free or reduced. Like, I used to work at a community behavioral health center, and, like, I was a pretty good therapist then, and it was still,
Still
like
you.
still, like but it was
Still
still,
you.
like, reduced and stuff like that. So,
Okay.
it's just good to notice that.
And then the one last thing I just wanted to cover is like, how long should you expect to go to therapy? I mean, I think that's I know we both are like laugh about it because it depends on the person, it depends on the issue, it depends on
Yeah.
so many different factors.
Mhm.
But I know it's a question that people ask a lot.
Yeah, or how frequently to go, and that's one of the things,
Mhm.
like, I kinda walk with people and I go, like, the way that I view it, is go when you need it, sit out when you don't, go back when you need it again, sit out when
Right.
you don't. But yeah, it could be lifetime. I don't think it has to be like 3 times a week like Woody Allen movies portray. I think it could be, just like maybe you go like once every other week for a little while. But it depends. Like I see a lot of people gain so many skills and feel so much better that like if it is just like a one incident thing, like, we don't have that many sessions, like, we might
Right.
only get to that 6 sessions or 12 sessions, um, but if it's something, like, bigger and deeper and whatever, then yeah, I have some relationships with, clients that have been 5, 10 years,
Mhm.
depending on, like, who would what their stuff is,
It kind of reminds me of like I look at it as like I did with my acupuncture. Whereas when I first started acupuncture, I was in bad shape, like really bad shape. I was on all kinds of pain meds. Like I was hurting, my neck was messed up bad. And I went twice a week for 4 weeks, for 1 month. And then after that, I was once a week
Mhm.
for I think maybe 6 months. I mean, it was a while, I'm not gonna
Yeah,
lie,
yeah,
but then after about 6 months, it was every other week, and then
mhm,
we got to a point where it was once a month, unless
right,
something flared up, then I went back, got a reassessment, and then we
yep,
went more often until that was taken care of, and I think too often we treat our healthcare, whether it's physical or mental, emotional, right, as if it's only reactive. And I like
right,
in acupuncture, we used to call it my maintenance,
mhm,
like
yeah,
you go to just make sure. And so I think it's perfectly okay to, check in once a month or something if you want. Or
yeah,
again, once you develop those skills, you feel good. If something happens, you have a great therapist on speed dial that you can be like, hey,
yeah,
shit just went crazy. I'd love to touch base if that's cool. Can I come
yep.
cry for an hour?
Like, "Okay, so I have a dumpster fire. You still have that fire extinguisher, right?" And I'm like, "Uh-huh, I
Right?
sure do. I
Can I
sure
use
do."
that for a bit? Like,
Yep.
that'd be cool.
Mhm.
Thanks.
Yeah.
Yeah.
Yeah, yeah, yeah.
Yep, absolutely. Perfect. Okay. Well, if there is there anything else that you think we need to cover? And if not, what's one thing you want to share with everybody before we sign off?
I think that I don't really have anything else to really add about, therapy or therapists. I think the one thing I would touch on just to wrap it up nicely from the beginning is, like, use whatever language with your therapist that you are comfortable with. I tend to look like Pollyanna, so people don't drop a lot of F-bombs around me, but I was raised by an oil fielder, so I am fluent.
Uh,
Um,
she's my best friend. So
so my whole thing is just, like, just make sure that that's not like, that that's okay for you to
yeah,
cross those kinds of things too, because you don't wanna be, like, minding your P's and Q's, you
right.
know? You
Right.
want it to be a safe and comfortable environment, and so that's why I always tell people, like, "Yeah, if you gotta say fuck, it's alright." Like, I've heard it, I say it, it's okay, you know?
Right. We do have one question from Maura. We're a little bit over, but I'm okay with answering this if you are.
Sure.
Yeah. So she asked, what's your opinion on helplines? I've referred people to them, so would love to know what you think.
Well, I'm not I'm not a 24-hour therapist, right?
Right.
I think helplines are absolutely essential for when people do have more acute things happening um, in the middle of the night. Because I know my clients don't have my number for that, you know.
Right.
Um,
Right.
so for me, I think that helplines are incredibly helpful. I think that I also know that like not every person who's on those is fully trained. So they can be a little sketch sometimes, but it's honestly it's better than nothing. And I think that if somebody needs that acute help, then absolutely. I also know that like there's the NAMI warm line, which is actually manned by people who either have like a mental illness or have a close family member or friend that has a mental illness, and so like they have like a very different perspective than some others. So yeah, I think that helplines are incredibly helpful, and I really recommend if people are in crisis, please use them. Please, please, please use them.
And since we're talking about it, I just looked it up to make sure I was right. But it's 988 is the suicide and crisis lifeline.
Yes.
So if you know anyone that is in distress or you're in distress, 988 is the number that you can call. And I would, the one thing I'll say about it is that I think just like I agree with exactly what Morgan said. Just it has to be followed up. Don't use it as therapy. Don't
Right.
use that one phone call as like, oh, all right, blew off that steam. Everything's cool now. If you got into a position where you needed to call a helpline, which is nothing to be ashamed of at
Right.
all, okay? But if you were in a position where you wanted to call a helpline, you need help. And it's
Yeah.
okay to reach out for that. It's okay to look for that. I would really hope that you do. Oh my gosh, I hope that you do. My true desire is that more people would get the help that they need.
Yeah.
It's so not as scary as you think it is. I swear to God, it's not, especially if you get the right therapist for you.
Mhm.
It is such a freeing and empowering experience. Like I support therapy 100,000,000%. I mean,
Yeah.
I'm a beautiful poster child for it.
Indeed, you are. Well, and I think that is one of the things. I also think like it's not like what you see on TV. It's not gonna like your therapist is gonna be very human, you know,
Yeah, because you are.
because we are.
Yeah.
And like I'm very much like what you see is what you get. So
Yeah.
you
Yeah.
know,
Awesome. All right. Well, thank you so much, Morgan, again for coming, for joining me tonight. I always appreciate our conversations. If you guys have any questions, please feel free to put them in the comments and we'll do our best to answer them over the next few days. Wish you the best. Have a great week. And hopefully you'll join us for our episode next week. All right.
all right. Bye,
Take
everyone.
care. Thank you so much for joining us on the Energetic Psyche, a weekly podcast hosted live every Tuesday night at 7 p.m. Central Time by yours truly, Dr. Adrian Campbell. We hope to see you next week. We're live on Facebook, Instagram, and LinkedIn, but if you don't catch us live, check the next day for a full episode on Spotify or YouTube. I hope you have a lovely week, and I hope you'll join us next Tuesday.